And now to the National Assembly, where the House of Representatives Committee on Health Institutions has raised concerns over migration of health workers from Nigeria to other countries in search of greener pastures, saying it poses significant challenge to the nation's healthcare system. Chairman House Committee on Health Institutions, Mr. Amos Gwamna MAGAJI, raised the concern during a public hearing on 16 bills aimed at establishing some more health institutions in the country on Thursday at the National Assembly. The lawmaker said the hearing was called to provide guidance on the actualization of the federal government's commitment to improving the healthcare sector through the wide distribution of healthcare institutions in Nigeria.
More recently, there has been an enormous migration of doctors, nurses, and other health workers in search of greener pasture in other countries, leaving Nigeria's health sector severely understaffed. The need to reposition the healthcare sector to meet numerous emerging challenges is critical to its improvement. To succeed in this era, a system that is well invested on human resource and medical intelligence as the bedrock of the healthcare sector is required.
Meanwhile, Minister of Health, Professor Mohammed Ali Pate, in his remarks, warned against duplication of health institutions across the country, saying it will be counterproductive to duplicate efforts, especially in this era of scarce resources. The minister, represented by the director in the ministry, Dr. Jimo Olawale Salahuddin, said health sector research, including that of the cardiology, is already taking place in many fronts in Nigeria. As such, establishing the institute will be an additional financial burden on government, since the government is cutting down on the cost of governance by pruning down agencies of government.
The migration of health workers and the epidemics and their emerging trends underscore the need for Nigeria to have enough and an efficient health workforce that will be readily available when there are any health emergencies. This is the observation of the ministry and our position. The Federal Ministry of Health has no objection to the establishment of the proposed federal tertiary health institutions. However, this should be based on merit.
The bills are for the establishment of teaching hospitals, federal medical centers, and other health institutions across the country.